We might get into a situation where patients are going to be redirected to other hospitals, and we're going to find it more and more difficult to treat all the other stuff that's going on in society. The healthcare system is not infinite.
Looks like it's time to put these back on. Quebec is now strongly recommending people of all ages wear them in public spaces except in schools and daycares. Masking is not being mandated, but officials say a cocktail of viruses is on the rise and overcrowding hospital emergency rooms.
We do not need right now to make it mandatory. It's something that is that needs to be considered really delicately, because you put a pressure on citizens, and with other measures that should accompany that, we're not at that point.
If you're going to use masks anywhere, you want to use it in the place where people are getting the most sick. Right now, the biggest issue is the overflowing pediatric hospital. So, it's going to make a bit of a difference if the rest of the population wears masks, but it's children who are most at risk now. They're the ones that need to be protected. Will this recommendation change people's behavior? I'm not sure, because unfortunately, when people hear recommended, they interpret that to mean optional. And if people think something is optional, they tend not to do it.
The province is experiencing a triple threat of respiratory illnesses, with COVID-19, influenza, and RSV on the rise among children, causing an overflow of pediatric hospital admissions and putting many over capacity. As of 10:30 a.m. on Wednesday, the Montreal Children's Hospital was at 125% capacity. The Jewish General Hospital at 189 capacity in its emergency room. In order to reduce the number of hospitalizations, officials are asking Quebecers to do three things. First, mask, and then utilize basic hygiene.
It's important to wash your hands, because we're not only dealing with COVID now, we're dealing with influenza. And one of the ways to protect ourselves is really to wash your hand against influenza. And the third measure that Dr. Boileau had said many times in many point price that we had is, if you have fever, you stay home. And if you have symptoms, you wear a mask.
When people talk about learning to live with the virus, well, look around you. This is the situation we're going to have to learn to live with. Shortages of children's Tylenol, parents waiting 12, 18, 24 hours to see a doctor, people leaving the emergency room because the waits are so long that they're not seeing anyone.
Other measures previously announced geared at reducing the strain on hospitals include the opening of 3 nurse-run clinics in Montreal, expanding the 811 healthcare phone line to allow parents to find a doctor's appointment for their children, and staying up to date with COVID-19 and flu vaccinations.
J'aimerais ça que les plus jeunes aillent se faire vacciner aussi.
I'd like to see the youth get vaccinated too. If you ask me for a number, I'd like to see it doubled. A month ago, we were saying that we could easily do 30,000 to 40,000 vaccinations a day. We're doing 18,000 to 20,000 a day right now, so I'd like to see that number doubled. When it comes to our vulnerable clients, I think the job is done, but I would like to see the youth go out and get vaccinated, especially with Christmas being just a month away. In Montreal, Sasha Teman, City News.